everyone, and welcome to this week's Healthcare Careers in Focus session. This week is National Pathology Week, and so what better topic to cover than healthcare sciences? We have three wonderful speakers for you who I'm sure are going to enlighten you about this profession and the various sectors that you could work in. So up first is Karen, who specialises in radiotherapy physics. Karen.
Okay, so although I specialise in radiotherapy physics, I also have a role as the lead scientist within our trust. And so I'm actually going to do a quick skim through all of the areas of healthcare science. So healthcare science is involved in the diagnosis, treatment and prevention of disease. And they're involved in 80% of all clinical decisions. Every day, healthcare scientists are involved in making decisions that affect patient care. So the work that we do is really important and impacts on almost all our patients in hospital. Next slide, please. So there are the healthcare science disciplines are split into four: laboratory science, or pathology and biochemistry. And you are actually going to have a few talks about these. So I'm going to try and keep my talk on that quite small. Physiological sciences, which is taking measurements from patients. Medical physics and clinical engineering, which is where I work, and bioinformatics, where we actually have very few staff at the moment, but it is an emerging profession. So we have a big group of renal technologists in our trust. So these are people who work with patients who are undergoing renal dialysis. They make sure that the renal dialysis machines are working properly. They're also involved in testing to make sure that the water purity is good. And they go out to patients' homes to set up and monitor the equipment that is being used for those patients' dialysis if they are being dialysed at home. Okay, next slide, please. Okay, laboratory science. So this covers a broad range of topics. And as we've got a couple of laboratory scientists on the talk, I'm actually going to ask for the next slide, please. And the next slide. Okay, so pharmacy quality control. So I don't think the others are going to speak about this, but this particular team of scientists go out and monitor the purity of pharmaceutical elements. So during COVID, they were involved in supplying solutions so that we could fit test the masks that we were using to make sure that we weren't going to get COVID. They go out and test oxygen facilities. And again, the photograph there is actually from during COVID, where obviously the military were helping to install temporary oxygen generators. But the pharmacy team, this particular team of scientists look at ensure that there's no impurities in the gas systems before they're used to test for patients. Next slide, please. Histopathology. So this is the staining of tissues and looking at those tissues under a microscope. They help make diagnoses and manage a patient's care. So they might, for example, diagnose a patient who has got a tumour, a cancer tumour, and to help with giving advice on what type of tumour that is. Next slide. Okay, let's look at physiological science. So some of you will have had physiological measurements carried out. Some of you might have been for a hearing test, for example, and that is performed by audiologists. Some of you might have experienced asthma or other breathing conditions. We have a big team of staff at the hospital who work in respiratory science. They actually work in respiratory and sleep. So they check for patients who maybe have got something that's causing them to wake up at night. And they will help with the management of those patients to try and ensure that they can get a good night's rest. And they do that through monitoring their physiological symptoms. Cardiac physiology. Again, cardiac to do with the heart. So, oh, thank you. We've moved on to respiratory. So neurophysiology. Okay, so neurophysiology is looking at electrical signals from the brain. So these staff will put little electrodes onto a patient's head, and it can be sometimes other areas of the body. So when they're doing a nerve conduction study, then they will look at the signals that your body is generating. They might look at producing stimuli by flashing a light, and they can use those to diagnose conditions such as muscular sclerosis. Carpal tunnel syndrome can be analysed by doing a nerve conduction study. They can look at muscle function and see whether people's muscles are still receiving the correct signal from the brain. Next slide. Cardiac physiology. So this is something that people have probably heard of. You've heard of people having pacemakers inserted, and maybe even heard that some patients have actually a little mini defibrillator inserted into their chest, so that if their heart stops, it will actually give them an electric shock. Now, those devices need looking after, they need monitoring, and the patients need to come for routine checkups to make sure that they are still healthy and well. And these scientists will actually undertake those measurements, undertake some of the regular checkups, and liaise with the doctors that are actually in overall charge of the patient's care. Audiology. Many of you will have had hearing tests, but also audiology also studies balance. Audiologists work with with patients from the newborn right through to patients who are much older. So they'll do a lot of newborn hearing tests, but they also work with the elderly who are impacted by hearing loss. They diagnose the amount of hearing loss, performing tests. They will help with the monitoring of any hearing devices that are implanted. They will fit hearing devices and then make sure that those patients get the best audiological signal, so the best hearing signal that they can for their condition. Okay, so medical physics and bioengineering. This is the area that I actually work in. It covers a wide range of specialties, from diagnosis, where we're looking at X-ray scanners and MRI scanners, right through to treatment facilities. Next slide. Okay, so nuclear medicine is one of the areas of medical physics. In nuclear medicine, we use a radioactive material that is usually in liquid form. It can be used either to treat disease or to take an image of the functions of organs in the body. So the radiopharmaceuticals or radioactive liquids are targeted onto something that will be taken up by the body, and then they will go to areas of the body where metabolism is happening. And so we can see, for example, we can get images of where cancer is growing. We can get images of where there's been a fracture. It's not usually used for fractures, but we will see those. The radiopharmacy team at Mount Vernon produce pharmaceuticals that are sent out to all of our neighbouring trusts as well. Okay, next slide. In radiotherapy physics, we work with machines called linear accelerators. These are high energy X-ray machines. And they can also take X-ray images of the body. So the patient will lie on a bed, which you can see here. And the responsibility of the physicist is to make sure that the machine is working correctly. Patients who are undergoing radiotherapy will come and they will have a CT scan. That CT scan, we will then design their treatment on what's called a treatment planning system. So we design which direction the radiation beam should be pointed. We also inject solid radioactive materials or radioactive seeds inside of a patient. Those can be either temporary or permanent implants. So we will go to theatre, the patient's under anaesthetic, and we will put radioactive seeds or needles that we can later insert a radioactive wire into. We'll then plan their treatment, decide how long the radioactive material should stay in a given position, and then proceed to treatment. We're involved in the legislative compliance, ensuring that everyone is safe, and that our patients are safe. One of the ways we ensure our patients are safe is by doing testing on our machines. And the bottom picture there, George and Jack, Jack is one of our trainees, but George and Jack are undertaking some measurements that are done each month on the treatment machine to make sure that the radiation beam that is coming out of the machine is as we would expect. Next slide, please. In order to ensure that our machines are working correctly, we employ a team of engineers. And these engineers are very specialist. They need knowledge of RF generation and electronics, but they work to try and maintain the machines. So they'll do preventative maintenance, and they'll also repair the machines when they have broken. We also employ mechanical engineers who might make equipment for our patients, or they might make devices for ensuring that the radiation beam doesn't go into an area that we don't want it to go. So that's Liam making a lead mask for a patient's treatment. Next slide. Okay. So this is Jerry preparing for a theatre session. He's got an ultrasound scanner, and he's actually just preparing prior to injecting the seeds. If you can, that's a duplicate slide. So if we can just, thank you. And then just briefly talking about bioinformatics and genomics. So we don't employ any bioinformatics staff at our trust at the moment. However, they will take patient data and look for, they'll undertake AI modeling, they'll look at genomic patterns, they'll look at data modeling, disease modeling, and then try to help use that data to help with patient treatment and patient care. I think that's my last slide. Yes. Okay, so thank you to all our healthcare scientists at Eastern North Herts. And if anybody has got any questions they would like to ask, I think you need to put those in the chat for me.
Thank you so much, Karen. That was really insightful. I find it incredible before I came into this sort of role, you would just think that it's just doctors and nurses that do all this treatment, but there's so much stuff that goes on in the background, and you guys just aren't represented, are you? People don't know about you, and you're the one that's actually sort of scheduling how someone's going to be treated, and you know, everything. I just find it incredible. Yeah, and that's why we shout about you a lot when we go to our careers events.
Also undertaking some of the treatments, you know, our respiratory scientists, sometimes it's undertaking treatment as well. And us being very, very closely involved.
Okay, thank you, Karen. I don't think there are any questions for you at the moment. So I will introduce our next speaker, who is Dr. Marie, and she is one of our consultant clinical scientists. Dr. Marie.
Hi, good afternoon, everyone. My name's Marie. I am a consultant clinical scientist, and my specialty is clinical biochemistry, and I work at the Princess Alexandra Hospital in Harlow. So what's clinical biochemistry? Well, we help diagnose and manage patients by analysing their body fluids, and this can include all sorts of body fluids. So blood, mostly we look at the serum, which is the liquid that blood cells float in, and we also do tests on urine, feces, and spinal fluid, or CSF. So we can test them for all kinds of things, but it's mostly proteins, enzymes, hormones, vitamins, things like that. And my job is to look at the pattern of the patient test results to tell us why the patient might be unwell. Next slide, please. Thanks. So why is it important? Well, we provide crucial information that allows doctors to make diagnoses of disease in patients. And in some cases, we make the diagnoses ourselves. And this allows us to make sure that a patient gets correct and timely treatment. We also do tests that allow doctors to determine whether a patient is well enough to receive treatment, and to determine whether that treatment is effective. So, for example, patients who are undergoing chemotherapy for their cancer. We have to be able to provide results really quickly. So if somebody comes into an emergency department, let's say, we have to be able to provide results within 60 minutes of that patient arriving in the hospital if they're acutely unwell. And that allows our doctors to treat them quickly and safely. In some cases, potentially save their lives, but also if there isn't anything very seriously wrong with them, it allows us to treat them and get them home rather than them being stuck in an ED department for hours on end. Thank you. Next slide. So how do we contribute to patient care? Well, we're a support and advisory service really to medical professions, looking at the patterns of results and helping diagnose illness. So to give you an example, on Christmas Eve about 9 years ago, I was working at a different hospital in London, and a very high glucose result came through on a patient who was from a local women's prison near where I worked. It was actually Christmas Eve, and I spent 2 hours trying to get hold of a medical professional at the prison who could take the results. And I eventually did, and the patient in question was found unconscious in their cell in a diabetic coma. And they were an undiagnosed diabetic, and without the lab's intervention that day, they would probably have died. So you can see what seems like something really, really small. If you my job is to understand the relevance of it, the relevance to disease, and to make sure that a doctor or somebody who can action and treat that patient finds out about the results in good time. So who works in our team? Well, you can see there's myself, a consultant clinical scientist. There is also a consultant chemical pathologist who is a medical doctor. My doctor is a PhD. And she does clinics around looking at people's cholesterol and lipid levels, as well as doing some clinical work within the lab. So we also have 4 consultant hematologists who are doctors, 3 lead biomedical scientists, and I have a colleague who will be speaking after me who is a biomedical scientist and will explain a little bit more about that profession. We have a team of about 30 biomedical scientists and about 15 support staff. So you can see it's a really, really wide-ranging department within pathology, and particularly within blood sciences, that covers a spectrum of careers. Thank you. Next one. So what's my favorite part of my job? Well, I love teaching. I'm here today. I like to talk about what I do, and I also like to talk about this as a career, because as Karen said, and as Kerry said, it's a career that is actually incredibly instrumental in the patient journey, and not very many people know about it. When people talk about working in healthcare, they think, oh, I either have to be a doctor or a nurse, but actually there's a huge gamut of careers where you can make a really big difference. So I teach doctors, nurses, pharmacists, physicians assistants within the hospital about all aspects of clinical biochemistry that they're interested in. I supervise training portfolios for trainee biomedical scientists, and I have a lot of clinical interaction with doctors and other healthcare professionals. So helping them interpret results, advising on appropriate tests to help them determine the correct diagnosis for their patient. Next job, please. And what do I love about it? Well, I believe passionately in the NHS, and I think it's wonderful that in this country we have healthcare free at the point of access. And I also really regard it as a great privilege that I've been provided with a career where no 2 days are the same. But I know that every day, whether it's directly or indirectly, I'll have helped a patient and their family. Thank you. Next slide, please. So how do you train to be a consultant clinical scientist? Well, to train to be a consultant clinical scientist in any pathology specialty, you first need to become a registered clinical scientist and then complete a 5-year higher specialist training program to demonstrate that you've achieved the equivalent education, training and experience in order to become a consultant. So higher specialist training equips you with both knowledge and practical experience that allows you to oversee a pathology laboratory service, and with the support and supervision of your senior colleagues, you gradually gain more independence. You have opportunities to teach, to take part in research, conduct clinical audits, and lead on all kinds of quality improvement activities. Next slide, please. So, how do you become a registered clinical scientist? Well, to become a clinical scientist, you can either train by what's called the STP program, which is the scientist training program, or you can train as a biomedical scientist and then use your existing knowledge and experience to gain either an IBMS certificate of attainment or a certificate of equivalence from the Academy of Healthcare Science. And then you are able to register as a clinical scientist with the Healthcare and Professions Council. Now, the HCPC is the governing body which covers all kind of clinical scientists and allied health professionals. Next slide, please. So the scientist training program. So with the right qualifications, you can apply for a trainee scientist, clinical scientist post, and they're advertised and coordinated through the Modernising Scientific Careers Scheme. A scientific training program lasts about 3 years, and it's a mixture of academic study and practical experience. So on completion of the STP, you're awarded a certificate of completion of scientist training program by the National School of Healthcare Science. And they have a website if you're interested to see any more about that. Next slide, please. So once you're registered as a clinical scientist with the HCPC, you can then apply for a training post on a higher specialist training program. And that's as part of the National School of Healthcare Science. And then you do 5 more years training. And as part of that, you need to pass the college's, the Royal College of Pathologists Part 1 and Part 2 exams in your chosen specialty. Next slide, please. Okay. So higher specialist training equips you with all the specialist skills and knowledge you need to manage the laboratory service. They will involve experiential working, gaining practical and clinical skills, observing and assisting and discussing aspects of practice with senior and consultant scientific staff and medical staff and other members of the multi-professional team. It'll help develop your understanding of diagnosis, of patient management, and the meaning of good scientific practice. And you need to be able to demonstrate key aspects of professional competency, including your communication skills, and working with the standards of evidence-based medicine. But you'll also be expected to seek out and organise experiential or opportunistic learning opportunities for yourself. For example, attending team meetings, directorate meetings within your specialty, teaching undergraduates or other health professionals, or even completing doctoral level research. Next slide, please. So that's my last slide. Please feel free to put any questions in the chat. It's a career I can heartily recommend. And yeah, thank you very much for your attention.
Thank you, Dr. Marie. I did just ask something actually, and I just out of curiosity really. So I know when you sort of do an apprenticeship, for example, you have to be working within that sort of profession to then be able to do training. So does that work the same when you choose your speciality? Do you need to then be working within that speciality?
Yes, you do. So
okay,
when you sign up for the scientific training scheme, it's not a generic training across all disciplines. You have to pick a specialty at that point, and you're employed into a training post within that specialty. So so when you apply, you will apply for a post within a specific specialty. So that clinical scientists within the kind of more biological and medicinal aspects of pathology only exist at the present time in clinical biochemistry and in microbiology. Histopathology have been quite slow in coming on board with clinical scientists. Most of their consultants are actually medics rather than clinical scientists. Clinical biochemistry consultants have been clinical scientists for a really long time. Microbiology are now beginning to catch up. So they have a mixture of the two, a bit like biochemistry do, but histopathology have been quite slow to come on board with that. There are 1 or 2, but they have been much slower to come on board in that specialty.
Yeah, so when you spoke about that you assess and you look at sort of different specimens, because a lot of
Yes.
when we go to careers events, they'll be like, oh no, I don't want to do that. I don't want to start like digging through poo and things like that. And it's just I don't think it's quite like that. So can you explain a bit more about how those
Yeah,
specimens come in and how?
Yeah, so the specimens come in, they're all in containers. So the slightly more unpleasant ones, so let's say the urine and the feces, they come in pots where, don't get me wrong, you have to open them and kind of take small samples out of them, but there's no real digging about in large amounts of feces or anything like that. So a lot of the urine specimens now come in tubes that actually go straight on to our analyzers. The feces, they come in, we have special samplers for some tests, which the patient themselves can actually sample it from their own feces, and then the small sampler is actually sent into the laboratory. It's got a very tiny amount of feces on, which is often all we need in order to be able to do our tests. Or we ask for a very small sample to come in, and then they're dealt with appropriately within the laboratory. Don't get me wrong, there is the handling of some things which people might find unsavory, but it's amazing how quickly you get used to it.
Yeah, just becomes the norm.
Yeah, it does.
Yeah.
Yeah, and it does, and you do get used to it very, very quickly. And technology has come on a lot further now than when I started 25 years ago, where there were a lot more kind of larger buckets and of fairly, of unsavory kind of body fluids and samples, which we had to deal with back then because our technology wasn't as advanced as it is now. So everything's got a lot smaller, and we can do a lot more with a lot less.
Perfect. Well, thank you very much, Dr. Marie. There are no other questions, just my questions for you. And so we're going to go on to our final speaker, and by no means least, we've got Anand, who specialises in pathology.
Hi, good afternoon, everyone. Okay, so I think I'm Anand Pancholi. I work as a deputy pathology manager, but I'm a biomedical scientist by profession, and I work with Watford General Hospital. So in terms of my career journey, I've done BSc with chemistry, then I've done MSc biomedical science and MSc molecular biology. I've got 20 years of laboratory experience. I started my journey as a biomedical scientist in the field of hematology and blood transfusion, a little bit of immunology at the time as well, and then worked as a senior biomedical scientist, as a lab manager. I've also worked as a pathology IT manager, managing pathology laboratory information system, and then worked as a head BMS of the blood sciences department, managing point of care, phlebotomy, very wider role. And then as well as now currently I work as a deputy pathology manager, but my main duty is a quality and a training management within the pathology. So as a quality and a training manager too. Moving on to next slide, please. So what is biomedical science? So we got various disciplines, which is coming along on your slide. And I'm just going to go for very core biomedical scientist or pathology department here. That's what we offer within our trust currently. So hematology and blood transfusion, which is more to do with the blood. Biochemistry, I think we had a very detailed information from Marie, so I won't go in much detail in biochemistry because you had it all. Immunology, mainly testing allergy. Cellular pathology is mainly testing organs and a cell. So when a doctor takes a biopsy, in the clinic or in the hospitals, or take the organs out for cancer investigation, that's where the cell part comes into the play. And molecular biology is more of a genetic diseases. Moving on to next slide. So, and last, I mentioned about point of care. So point of care is your remote, like your small devices, which are available in various parts of the hospital. Even patient can test their glucose and their clotting results and whatnot at home, or sometimes the quick full blood count, if they want to do, they will use a point of care equipment. So that's for a quick diagnosis for the patient's diseases. Moving on to next slide. Okay, so hematology. So we do the basic test in hematology is a full blood count, that is to identify any RBC, platelet, and WBC related disease, as well as infections like malaria or parasite or any other infections you may have. We also do the bone marrow examination, again for various hematological conditions. And we do clotting study within hematology as well to identify any clotting related disease. Like, I don't know if you have heard of hemophilia disease and hemophilia A, hemophilia B, that sort of disease. The basic thing will start with the basic clotting study in terms of diagnosis. And there are lots of factors associated with your clotting pathway. So again, that would be diagnosed within the hematology stroke coagulation department. In terms, my apologies. In terms of blood transfusion, we do the blood grouping and blood compatibility study with so there are donor units, so we get lots of units from NHSBT and we issue it to the patient requiring a blood. So we do compatibility study before, or testing, I should say, before we actually give a blood out to the patient. I think if you click next, there is a little picture coming up. Yeah. So no, I think gone too far. Just go on a slide. Yeah. So that's just a small picture of how the blood cell looks like under microscope. And you see there are 5 different types of bloods in there, and then red cell as well. So 5 different types of white cells and the red cells in there. But there are lots of variety, which I cannot go through now, but that's what you're probably identifying if you're a biomedical scientist in hematology. That's your day-to-day job. Okay, so coming to the biochemistry testing and immunology testing, I think biochemistry-wise, we have already got a lot of information from Marie, so I won't go in much detail, but I've kept it very simple. Immunology is allergy testing, and I've got a picture in there for you how an automated lab would look like. So a lot of testing happens on automated analyzer in hematology and biochemistry, and they are kind of on a one big track. And it sample will go like your car is moving on the road, and each analyzer will know which test to do, and they'll take that sample in there and they'll process and send the results back onto your laboratory information management system. Moving on to next slide, please. So cell path is further divided into andrology, histology, and cytology. It's mainly a study of organ and tissue. Andrology is modeled regarding fertility testing. Their basic practice is to fix the tissue, embed the tissue, then they make a slide out of those tissue, and then they stain them, and they check the cell structure and abnormalities. I think one of my co-presenter in a first presentation shared some fantastic picture. How does it look like under the microscope for cell path? And there's a picture of a microtome, so that's mainly used by biomedical scientists in histology to make slides out of the embedded blocks. So the blocks are like in a wax. So they mount the tissues in the wax. They fix the tissue first, and they do a cutting, and then they fix it in this wax block. And that wax block is mounted onto this equipment, and they take a slide. They make a slide. So they take a section and put it on a glass slide for staining and further investigation. Next slide, please. So tests performed by microbiology, they do lots of testing in terms of infectious disease. So COVID was one of them in a recent time, which microbiology was facing the trouble with. But they do culture of the blood. They also check cerebral spinal fluid. They check the stool, tissue, and other human samples for anaerobic and aerobic mycobacterial and bacteria species, and as well as the fungus investigation. They do lots of staining, like they call it a gram staining, gram positive, gram negative. And once they identify, they do further study and identify the actual bacteria, so that the consultant can treat them accordingly. It's a rapid detection of influenza, streptococcus, Clostridium difficile. There are lots of common things they do test day in, day out for inpatient as well as outpatient as well. and examination of stools and other body fluids, and as well as the parasite. Can we click next? There are a few more things here. So there's HIV, hepatitis C, influenza. All the testing happens within the microbiology laboratory. There's one more in there. If you click next, please, yeah. And that's a C. diff, confirmatory testing as well. And if you click one more, there's a nice picture. So that's the petri dishes for microbiology. So the basic concept is these petri dishes are has got different nutrients within that to grow different types of organism, and based on that, they will strike. Also, these are different striking patient pattern they use to identify type of bacteria they have grown in there, or and that's a picture of it that in real life you would see. Next slide, please. So biomedical scientists in general, they work with general practitioner, consultant, registrar, nurses, medical laboratory assistant who work under biomedical scientists. We call them support staff, and as well as the associate practitioner who are next level down to biomedical scientists. Associate practitioners generally kind of get your equipment ready, do your pipetting and whatnot. And we've also got a trainee biomedical scientist. So that is for person who wants to become biomedical scientist. And that could be from one of your own pool where we actually put forward them to the scientific training program for biomedical scientists. So they get to do the degree, and then at the same time they do the portfolio if they're not, if they've just finished the A-level, and that apprenticeship route can be applied to that. Or we also work with a university where there are university accredited courses, and we take the student from them there, and then they do the trainee portfolio for 1 year with us. That is provided by Institute of Biomedical Science. And then at the end of a completion of the successful portfolio, they'll get a certificate of competence, which they submit to HCPC, which is a Health and Care Professional Council, which is our governing body. And they will then become a state registered scientist. So that means they can go and work in the area of discipline. The portfolios are very generic to start with, so it's a pathology wide, and then you can select which discipline you want to go to. You can do your portfolio in discipline specific as well. So if you want to be a hematology biomedical scientist, then you do your portfolio in hematology and then chemistry. But in terms of portfolio content, they're very generic. There is a very little part where there's a technical bits you have to do. Yeah, and then as I mentioned, accredited courses are run by Institute of Biomedical Scientists. So next slide, please. What's a day in the life of a biomedical scientist? So basically, you're working with equipments, analyzer, and various reagents, and patient samples as well. I've not mentioned it, but that not to be, it's patient samples are usually contained within the vacuum. It's very rarely you deal with an open container sample, especially in microbiology, you deal with a lot of open sample and cell path as well. But in the blood sciences, you don't. Very rarely you deal with open sample. Maintenance and calibration of equipment, you run the day quality control. So internal quality control, as well as we register with lots of external quality assurance scheme. So you would have those samples you'd be running. We also take audit and participate in incident management as well. So if there are any errors made in this incident, we investigate why it happened, we learn from it, and we try not to make that mistake again. We've got regulatory and governing standards. So we've got ISO 15189:2022 standards the lab has to comply with, as well as MHRA's governing standard and HT and HSC governing standard. They are regulatory standards. So we make sure that all our work training, staff training is in line with those standards. In general, we authorize results and follow up any abnormal results. So if there are abnormal results, we'll contact GP, we'll contact the right people to follow up the patient on that. So basically, we provide diagnostic support to clinicians and nurses. And if you just click next, I think we provide 24/7, 365 days of service in our laboratory. So We have obviously got a rota system, so there is out of hours working. Okay, so next slide is about rewards and challenges. So what are the rewards? The rewards are 85% of patient is diagnosis dependent on pathology tests. So that gives you self-relief. I think my previous two presenter mentioned how well you feel when you have made a difference in patient's life. And that's more rewarding than ever again. It's a well-paid job and it's a good high job satisfaction. If you are a science person, if you don't want to be a doctor but want to make a difference, it is also a good well-paid job in terms of NHS. So the normal salary, if you're experienced scientist, you're band 6, you're looking around 40-45K. And support people's life and make a difference, I mentioned. And there are lots of options within the profession to develop your career. So I think my previous presenter mentioned that you can become clinical scientist. You can also, like I have been an IT manager, so you can even go in IT. You can also do a bit of a data analysis. And if you want to develop into the bioinformatics, you can. As you go up, you can go in a management, quality, and a training role. So you can be a quality manager, you can be a training manager. And if you're in a management, you can also go on to become a leader, leadership role, like a director role. So there's lots of options available. Challenges, I think I mentioned, is social hours of work. If you're a basic grade scientist, that is expected, especially in blood sciences. Maybe not on histopathology, very rarely, and microbiology. Yeah. And the other challenge on a day-to-day basis is the timely results provision, because we've got a strict turnaround time from ED, samples coming from ED in blood sciences, as well as some of the screening samples as well. We've got strict turnaround time that we have to turn them around within 7 days or 10 days or whatever. So that is a challenge. And the one and biggest one is meeting the regulation with MHRA, UCAS, HD, and HSE. So I mentioned about those standards, and we have to ensure that we are UCAS accredited and we meet the MHRA standards so that we can operate our blood transfusion laboratories. Advice to my younger self: if you want to become a biomedical scientist, I would say be good with your mathematics and biology. Learn to pay attention to details. That's a key requirement as a biomedical scientist. You might think, okay, so one result, I can let it go, but you may want to check the previous results in clinical detail. Lots of things you've got to consider before you click hit, say, yeah, it's okay to go without flagging it to clinician. Gain some and if you want to become biomedical scientist, you can gain some laboratory experience as medical laboratory assistants. As I mentioned, we take a trainee positions from our MLA and we make them into biomedical scientists. And if you are considering by a degree route, then maybe go look for IBMS accredited degree. Your degree is offered by the university. So if you're applying to university, make sure there are those biomedical scientists courses are accredited. So at the end of it, you can become biomedical scientist. There are sandwich courses available as well, where it's 4 years, so you can do a placement, and that's where we will get those students from university in that particular year. So I think that's end of my presentation, but there is few more bits I've added. Is about I think there is a case study. I'm not sure whether I'm supposed to discuss this here. I'm more than happy to continue. So how all discipline comes together. So I picked up a case study. Let's say there's a 25-year-old South Asian woman married to an African man, is expecting a first baby. If you can, next slide, please. So when this sort of sample comes into the pathology, for us, the origin is very important for what diagnosis we will make. A partner's origin is also important because it's coming from antenatal screening, and she's young and also childbearing age. So very important for future pregnancy to consider pathology investigation and intervention. So when we issue the blood or whatnot, we have to be considerate. So that's the first thing we'll consider. I think next slide, please. So in terms of treatment and support, so how does the treatment start for a woman who is expecting a first baby? So pregnancy test on a point of care device. I mentioned point of care. Then at 12 week, there's the first antenatal screening is performed in antenatal clinic, and they'll send the sample over to pathology. There's a family origin questionnaire is filled for hemoglobinopathy screening as well as for microbiology, infectious disease screening. Next one, please. Yeah. So sample taken is full blood count, group and screen, which is for transfusion, HIV, syphilis, and Hep B screening is for microbiology, infectious disease. What are we looking for? So hematology, especially hematology, we're looking for, are there any hemoglobinopathy disease which can pass on to the baby, considering mother and father are carrying the same genes or whatnot. And it shows beta thalassemia carrier, which again can be further investigated with the genetic study. So, you know, the molecular diagnostic part of the part can diagnose that. And blood transfusion shows RHD negative. Patient is RHD negative. That means we need to check a father's blood. If the father is RHD positive, then likelihood is baby can be RHD positive. That means the mom will need an NTD dose to protect the baby, and we have to monitor the NTD level throughout the pregnancy, because that antibody can cause a lot of problem to both mother and child and unborn baby. And infectious disease screen is to confirm that those HIV and whatnot, which can pass on to baby, they are negative, and if they are positive, the baby is protected in the right way when they are born. So quite a lot of discipline involved with one simple testing. At delivery, the consultant decided to perform a cesarean as there was a fibroid identified during 20-week pregnancy screening. Before the operation, again, the blood transfusion grouping and infection screening takes place. When the operation happened, a small fibroid tissue was sent to histology department. Again, look, the histology is coming into play now to see if there is a cancer or whatnot. Is it normal fibroid or just not? And after the operation, patients require a blood transfusion due to blood loss. So again, in that case, a transfusion is involved where they will cross-match the blood. And obviously, baby's blood would be tested at that point. And if it's rhesus negative, it's all fine. But if, as I mentioned, if it's rhesus positive, then we'll do another investigation for, we call it a CLIAV study to determine the level of NTD. And then we will then give determine the level of the rhesus antigen, and then we'll give the NTD accordingly. So, and as well as when we issue the blood to the mom, we'll make sure there are some clinically significant antibody which can cause serious problem in future pregnancy. So we make sure the blood provided are negative of those units, especially, for example, a CAL antibody, which can cause a serious HDN disease. So that's why we make sure that it is negative for that. Next slide, please. So in general, the biomedical scientist is sort of a multidisciplinary working. The phlebotomist are collecting blood. Point of care device is used throughout the care. Antenatal team, including consultants. In this particular example, these are the teams involved with the patient journey. Surgeons involved, specimen reception of medical assistant who receive the bloods, which is an important part of the pathology, because if you don't receive it correctly, and let's say if you're two patients and you mix them up, the results are going to the wrong person. So it's a very critical role. Associate practitioner help run the sample. They will prepare the analyzer. They'll do all pre-analytical work. Biomedical scientists will interpret the results, will do the cross-matching and whatnot. Nurses will do the follow-up as advised by the BMS. If you have got identified thalassemia carrier, that's something we'll feed back to the antenatal nursing team, and they will arrange the partner testing. And if there are further testing and the counseling required for the patient, whether they want to carry on with the pregnancy, would be provided by those nurses. Pathology consultant help with further testing and diagnosis and comments. If there are abnormal results, we'll always take advice from a consultant, how best we can communicate with the patient and the clinician related to the patient. And transfusion practitioner, they do train lots of new clinical staff and non-medical staff as well, how to collect blood, how to order blood collect correctly, and how to act on the abnormal results if there are any. and training and quality BMS work in the background to ensure results are accurate and on timely manner. So that's all in all. Thank you very much. If you have any questions, I'll quickly check.
Thank you so much,
Chat
Anand. I
box.
don't think there are any questions in the Q&A. No.
Yeah, no.
That's fine. Thank you so much.
Perfect.
I always think when you said, oh, make sure that you do your mathematics and you're very sort of zoned in on what you're doing and being very particular. I wish I concentrated more in science and maths, because I definitely think that this is something that would be right up my street if I was to do it all again. I find it fascinating. So that is our sessions come to a close. So thank you so much to everyone that attended today, and a huge thank you to our presenters. We can't do this without you, so it's absolutely pivotal that you're so willing to be involved. So thank you so much. These sessions are recorded, like I said, so if you want to recap, or if you've got someone that wants to that wanted to come along but they couldn't make it, send them to the YouTube channel, and all of the sessions will be uploaded there. We do have a QR code. We do want to make these sessions as appropriate and suitable for you as possible. So if you could give us any feedback on the session that you've observed today, scan the QR code now and give us your feedback, and that would be brilliant. Thank you very much. And that ends the session.